Hello, Dr. Roberts speaking.
Hi, I'm Katica.
I will be interpreting for you today.
Hello, Katica. I'd like you to interpret for Mrs. Horvath here. We've performed an angiogram on her today, and I'm about to give the results.
Okay.
Phone interpreting is a quick and cost-effective way of accessing an interpreter. In this situation, Katica is providing phone interpreting for Dr. Roberts' meeting with cardiology patient Mrs. Horvath.
Dr. Roberts?
Can you please pass the phone to the patient?
Sorry.
Molim.
Halo, ja sam Katica. Ja ću vam tumačiti danas. Prevešću vam sve što doktor kaže i prevešću doktoru sve što vi kažete.
Doktor je danas izveo koronarografiju na vama i sad vam treba dati rezultate. Svake puta kad ja završim sa tumačenjem, vi trebate dodati telefon doktoru.
A kada on završi govoriti, on će vama dodati telefon.
Dobro.
Before the phone assignment where possible, interpreters should ask for a briefing with a health professional to establish the context. They should ensure the privacy of the communication, have a notepad and pen ready for note-taking, introduce themselves and explain their role to the clients and ensure that everyone can hear and understand each other.
Gospođo Horvath?
Molim vas dodajte telefon doktoru.
Right. Mrs. Horvath, how are you feeling today?
Molim.
Gospođo Horvath, kako se osjećate danas?
Ne osjećam se dobro. Boli me u prsima i teško dišem i jako se brinem.
Gospođo Horvath?
Molim vas dodajte telefon doktoru.
Oprosti, izvolite.
Yes, Katica?
Dr. Roberts,
It is difficult to keep the flow of conversation going this way.
I think it would be better if you use the speakerphone.
Well, just a moment. I haven't used this before. Can you hear me?
Yes, clearly.
Excellent. Can you ask the patient if she's okay this way?
Gospođo Horvath, čujete li me dobro ovako?
Da, čujem vas.
Yes, she's fine with this. Now, in response to how she's feeling,
She said, I don't feel very well. I have chest pain.
I struggle with breathing and I'm very worried.
Although I interpret in the first person generally, sometimes in these situations I resort to interpreting in third person. Otherwise it is just too confusing for the patient over the telephone.
Mrs. Horvath, the results of your tests show that you have a blockage in the coronary artery. As you can see here, there's a narrowing of the artery that supplies blood to the heart.
Excuse me, doctor, if you don't mind.
Yes, Katica?
Because you appear to be showing something I can't see, I can only repeat what is said, but I cannot refer to the actual image.
Sorry. I have an angiogram in my hand. It shows a picture of the arteries. The artery wall has thickened where I'm pointing my finger, which is restricting the supply of blood to the heart.
Okay, if you don't mind, I'll explain this to the patient.
It would be good for you to keep your finger pointing to the relevant place while I interpret.
Sure.
And doctor will then say, look here now. And I have no idea what they are looking at because I'm on the telephone not looking at anything.
Je li to ozbiljno?
Is this serious?
Yes, it's very serious because the blockage is quite substantial. You can see here that the artery wall has thickened. This restricts the flow of blood to the heart. A clot can form, blocking the artery and causing a heart attack.
Da, veoma je ozbiljno, jer arterija je prilično začepljena. Može se stvoriti ugrušak, začepiti arteriju i tako prouzrokovati srčani udar.
A da li je potrebna operacija?
Does that mean that I need surgery?
Yes, I'm coming to that. Please be calm. I'll tell you what we're proposing to do.
Da, sad ćemo o tome. Samo se smirite. Objasnit ću vam što namjeravamo napraviti.
Pokušat ću.
Try.
A clot like this could ultimately cause death, so we need to perform an artery bypass.
Ovaj ugrušak krvi bi u krajnjem slučaju mogao uzrokovati smrt.
Da bismo to spriječili, trebamo napraviti operaciju
Kako mi
bypassa.
možete reći da se smirim, a sad ste mi rekli da mogu umrijeti?
How can you ask me to calm down when you just told me that I could die?
Well, it's very serious, but an artery bypass should fix the problem.
Da, ovo je veoma ozbiljno, ali operacija bypassa bi trebala riješiti problem.
A šta znači bypass?
What's a bypass?
Katita, you're a health interpreter. Can you explain it to Mrs. Horvath?
I'm sorry, doctor, I can only repeat what you say.
The actual explanation needs to come from you.
Fine. A bypass is when we take a healthy blood vessel from another part of your body. We then use the blood vessel to build a detour around the blockage in the coronary artery. The surgeon will access your heart either by cutting down the length of your breastbone.
Phone interpreting requires interpreters to take notes because people tend to speak longer when an interpreter is not present.
Or cutting underneath the left
I'm
nipple.
sorry, doctor. Can you just let me interpret because it is a long and complex explanation. Operacija bypassa se izvodi tako što se iz nekog drugog dijela vašeg tijela uzme zdrava krvna žila. Ta se krvna žila onda koristi da se napravi zaobilaznica oko začepljenog dijela vaše srčane arterije.
Da li može se dogoditi da operacija ne uspije?
Oprostite, gospođo Horvath, samo trenutak, dopustite mi da završim sa tumačenjem i onda ću vaše pitanje prenijeti doktoru.
Often they also cut in. Then I have to say, please let me interpret the whole passage, otherwise the translation will not be complete. Then I can interpret the question.
Dr. Roberts,
Mrs. Horvath asked if there is a possibility of failure with this surgery.
Well, like any operation, there are risks. They include possible hemorrhage, infection of the wound, heartbeat irregularity, kidney failure.
During phone interviews, healthcare providers should use a speaker telephone or a dual handset and sit close to the microphone. They should sit facing the patient and maintain eye contact. They should speak directly to the patient as you would in a face-to-face interview, and pause frequently to allow information to be taken in by the interpreter and passed on to the patient. Healthcare providers should compensate for the lack of visual cues by explaining to the interpreter what is happening.
We've performed this operation successfully hundreds of times. Please don't worry.
Ali gospođo Horvath, mi smo ovu operaciju uspješno izveli već stotinama puta. Molim vas, nemojte se brinuti.
Pokušat ću da se ne brinem. Ne bi baš htjela da ja budem ta koja će pokvariti vaš odličan rekord.